Welcome all listeners and participants to the 1339th day of continuous webinar. As you all know, today we have a wonderful guest in Dr. Suraj Singh BHADORIYA. And doctor has taken so many sessions in this forum, and one of the person who has dedicated his work in research and doing excellent job in publishing so many presentation in this forum. Thereby, we were able to upload all those things to the public so that more and more people can watch what is happening with the homeopathy in these present days. And this is what we need, because some people used to say that homeopathy is an unscientific system, but this is a beautiful system, the most scientific system. And Dr. Suraj Singh BHADORIYA has proven that it is one of the best scientific science system in the world. So let us introduce our guest of the day. He is working as an assistant professor in the Department of Homeopathic Pharmacy, Pearl University of Homeopathy and Research, Pearl University, Vadodara, Gujarat, has completed MD in homeopathy and that was in homeopathy pharmacy. He's a hardworking personality, and he is a person who guides so many people in into the field of homeopathy, and he has presented so many papers in research area, and not only that, he has attended so many research seminars all over the world, and that's the kind of person he is. Today, Dr. BHADORIYA will be presenting about FTIR analysis in homeopathic medicine. So we proudly welcome you to this session. Welcome, doctor.
Okay, just wait it, sir.
Yes.
Now it is visible to all of you, na?
Yes, define. Yes.
Okay. Now, first of all, good evening to everyone. Today we are going to start this new topic. It is under the process of standardization of the raw material, standardization for the many medicinal product, standardization for the many remedy, and some other solvent or the medicated formulary system. So today we are going to start this topic, that is FTIR analysis. It comes under the spectrophotometric analysis. It stands for Fourier transform infrared spectroscopy. So what it is? So basically, this FTIR is basically it is spectroscopy which is used for the analytical procedure, and this type of analytical procedure is generally used to determine various organic, polymeric, and some other inorganic materials which are present in our drug substances or the remedy or the raw material. This type of FTIR analysis is generally having the infrared light, which is used to scan the test sample and also observe and determine and analyze the chemical property of each and every solvent system. So this is the FTIR analysis. So next you can see the image of this particular tool, which is commonly used for the standardization. Is it visible to all?
Yes, yes.
Okay, so this is basically a setup of this FTIR analysis. Here you can see the first, this is the desktop. Here you can see all the graphical image and the presentation through the sample. And second one, this is a machine. It is a chamber of this FTIR, and here you can have a lens through which you can analyze and you can pass the IR infrared beam through the sample. And in this chamber, you have to take only one drop of your sample, which is placed over the lens. And after placing this sample over the lens, now you have to analyze under the IR spectroscopy, through which you can determine the various functional groups. So this is a general setup of IR spectroscopy, and it is generally easily available in any type of analytical lab. Either you talk about the qualitative or the quantitative analysis and the determination of various functional groups in our compounds. Now, moving towards the next slide, how this FTIR is going to work. So basically, this FTIR is having the infrared light, which is used for the determination of this compound. So it is going to work in between 10,000 to 100 centimeter through a sample. With some radiation, this light is going to absorb, and some other radiations are passes through the sample. The absorbed radiation is now converted into the rotational or the vibrational energy, which depends on the sample molecules. So basically what happened, suppose if you take any sample under this type of spectroscopy, so basically through this analysis, our samples possess various types of molecules, and through these molecules the energy and the light, the IR from this spectroscopy is getting absorbed, and these particular molecules are working at the certain intensity and the wavelength. This wavelengths may differ from different molecules, and as per this molecules they are rotated at different angle, at different energy level, and through this rotation they are going to show their different intensity. Through this intensity you can identify this particular molecules. So this is in general working principle of FTIR, and the resulting signals at the detector present at the spectrum, which is around typically 4,000 to 400 centimeter. So basically it is all about the molecular fingerprinting of any sample. Either it is your concentrated part, either it is the high dilution, either it is the moderate dilution, moderate concentration. So every type of sample need that type of analysis, which is totally based on the detection of functional groups. Which type of functional groups? They are going to determine the functional groups like carbon, nitrogen, and hydrogen, alcoholic group, aldehyde group. All these functional groups are going to used and determined by this type of spectroscopy. It is very commonly used for the any type of analytical procedure. If this technique has been used, so you can easily determine the alcohol compounds, the aliphatic compounds, aromatic compounds, non-aromatic compounds, and some other compounds which are present in our functional or the solvent system. So this is a basic principle of FTIR analysis. So it is very important to know about this particular mechanism. Moving towards the next slide. So it is regarding with how it is used for the various studies, how this FTIR is useful. Now, the basic objective of this FTIR is to identify and characterize the unknown material, because generally when we prepare the formulary, when we talk about the pharmaceutics, so generally in any type of formulation or the solvent system, there are n number of materials. Some are the solid substance, some are the semi solid, some are the powdered, some are the liquid. So generally this all type and different nature of the solvent system should be analyze at the different intensity, at the different biomolecular system, at the different nanoparticles, nanotechnology, at the different ionic property. So all this property, all this system, all this analytical procedure were used and were determined by this type of spectroscopy. The second point is to identifying the contamination, any type of impurities, unknown material, unknown particles, foreign particles. They are also going to determine by this type of spectrophotometer. The another one is it is going to use to identify the extraction from the polymer matrix. So generally when we talk about this type of polymer matrix, so we have to know about that type of objective and the analytical procedure which is only and only determined by FTIR. Extraction means what? Whenever you prepare any formulation, any solvent system, when suppose you extract the liquid material from the plant, from some other sources as per your pharmacopoeia, so you have to identify the various adjectives, various compounds, various molecules, various phytoconstituents, various metabolites, various active principles. So all these substances, all these materials are determined and identified by this type of analytical procedure. Next is to identify the oxidation and decomposition or uncure monomers in the failure of any investigation. So for this type of material, for this type of compounds, we use FTIR. So what we know, FTIR is one of the basic tool and very important technique which is used to identify the unknown origin in our solvent system. Got it my point? Now, next we have to understand what is the spectral interpretation, how we can interpret and study the spectral correlation. Spectral, it determines the various spectrum of the light, various spectrum of the intensity of different colors of light. So basically we have to show that FTIR is very powerful tool. So it is generally interpreted in the sense of the intensity at the different wavelength, at the different molecular system. So it depends on the absorbed energy response. So basically how much energy get absorbed by the different molecules or the compounds which are present in our solvent system, so they are going to reflect or they are going to make your spectral interpretation. The next point is the absorbed bands present in the spectrum are only somewhat discrete and degenerative. So generally this type of bands, this type of absorption peaks where somewhere going to shown a different intensity, somewhere they are very vague, somewhere they are very at the high peak, somewhere they are very down and the valley peak. So it depends on the amount of absorbed energy by a different molecules. If the molecule intensity, if the molecule absorb the higher amount of energy, so their spectrum is something very different as compared to the some other molecules which are in our solvent system. So generally depends on the molecular energy or the intensity of that particular molecules. The particular peak of this energy where somewhere work at the different wave number, a different chemical and the matrix factor. So these all are the spectral correlation which are commonly used for any type of spectrum and for any type of FTIR analysis. See, today this topic, maybe few people thought that it is very high level, it is a pharmacy part, we are the homeopath, why we study this? Basically, when we talk about our medicine, either it is concentrated like mother tinctures, either it is your high dilution, ultra high dilution, LM potency. So when we use this type of spectroscopy in your sample, so you can determine the n number of compounds or active principles and the nature of that particular compound, which are going to show their pharmacological activity on that particular viscera or the body part or the cellular system or the living entity. So definitely for that type of interpretation, for that vision, every homeopath should know about the process of standardization. What are the different tools? Why we use this particular tool? Suppose if you open your pharmaceutical store and your particular drug store and your company and any type of pharmaceutical procedure, if you want to prepare a various homeopathic external application, so you have to know about this type of tool and spectroscopy. So this is very, very important for our future also. Next slide. Now you can learn FTIR sample technique. So generally, this type of technique is very good and it is generally based on the energy of different particular metric system. And through this sample preparation, when we introduce this technique in our laboratory, so we analyze the sample, we analyze the different biomolecules, we analyze the different level of transmission through this particular molecule which is present in our drug substance. We are going to analyze the transmission through a laser or the infrared energy. This type of energy is going to use in our optical pathway and our film and the salt crystal or any type of mixing powder sample, a salt and the casting sample. So generally it determines that your sample should be in a powdered form. If suppose you are going to use some liquid semi-solid drug substances or the raw material, so it also go determine the functional groups. But in the powdered and the solid form, the intensity of that particular compounds may vary, differ as compared to the semi-solid and the liquid substances. So your sample should be the raw, the pure, and free from any type of adulteration. If suppose your sample having n number of impurities, if suppose it is having a mixture of different compounds, so ultimately you are not going to determine these functional groups at different intensity at different level. Now moving towards the next slide. Now see, this is in general example of FTIR analysis. It is on one hand you can see the graphical presentation. It is a picture, it is a graph. Here you can see on x-axis there is a wavelength. On y-axis there is a different percentage of transmission. So here you can see the number of peaks. So this number of peaks were determined by a different functional groups. So it is very, very important to know about this graphical presentation, what it reflects. Here you can see this is the highest peak. So here this highest peak, it found in between 1500 to 2000 1000 centimeter. So this highest peak is maybe your carboxyl group, maybe your CNH bond, maybe your oxygen hydrogen bond and nitrogen hydrogen bond, aliphatic compounds, and number of functional groups are there. So what type of functional group it is? It is depending on the solvent system. Suppose if the solvent system is alcoholic base, so generally it is very, very important to know about this particular functional groups. Now moving towards the next part, now you can see it is another graphical presentation. It is generally the FTIR analysis of the Lycopodium clavatum mother tincture. So basically this Lycopodium clavatum, generally it is prepared by the spores. And the main active principle of this Lycopodium clavatum mother tincture is ferulic acid. So here you can see these are the n number of peaks. Here you can see the highest peak. Here you can see this is a valley. So these are the different intensity and different peaks of different functional groups which are found in our solvent system. So here you can see this is the highest peak. So this highest peak is found nearby 1000 centimeter in the wavelength. So this highest peak is generally because of the aldehyde group, the aromatic ring, conjugated compounds, unconjugated compounds, generally the conjugation. What does it mean, conjugation? Conjugate means the junction and the joining of two different molecular compound, and then it form a new molecular system. So this type of conjugation, the joining in between the two different atoms were generally determine and identify at this highest peaks. So these highest peaks are generally used to determine that type of conjugation, that type of bonding, the bonding in between the atoms and different molecules. So this type of analysis is generally used for the FTIR. Here you can see a n number of peaks. Generally, it is very, very difficult and it is very vague until unless when you have a particular this type of analytical and the spectral interpretation. So when you are going to interpret this type of spectral analysis, so you can standardize your medicinal product, your remedy, and your mother tincture, mother solution, and the mother powder. So this is in general spectral interpretation. Next, you can see now this is another FTIR analysis of Lycopodium clavatum mother tincture from different pharmaceutical company. So generally when we talk about standardization and any type of research work which is generally done by our PG student and pharmacy people, so we procure the same mother tincture from different pharmaceutical company. Sometimes we procure the different mother tincture from same pharmaceutical company. So generally it gives you the generalized idea. It prevents the biasness. So here it is the holistic approach. The result and the conclusion is the generalized. So definitely we go for this type of a standardization FTIR analysis for same drug from different pharmaceutical company. So here you can also see the comparison. What is the differences in between the two different pharmaceutical drug? Even the preparation is same, even they follow the pharmacopoeia, even the mother tincture and the process to collect the drug is same, but still you can see the many differences. Now in this particular analysis you can see, suppose in 3320 nm, there is alcohol group, there is OH stretching bond, there is carboxyl group. In 2000 around it is 3 C double bond C stretching, so it is carbon carbon bond. So generally, this is another type of conjugation in between the two same or similar atoms. So it is a different analytical procedure. These are the different molecular system. So through this, you can analyze this type of FTIR analysis. Generally, in this small peaks, you have aliphatic compounds. You have a single bond compounds which have a single bond, not double and triplet. Generally, this double and triplet bond were seen in this highest peak, and this small peaks you can determine the single bond compounds, a single bond in between two different corresponding atoms. So this is a spectral correlation in the FTIR. On other hand, you can see the bond determination. So generally, the bond determination is regarding with a single bond strength, triplet, double bond, fingerprinting region in this vibrational frequency. So these are the different functional groups. These are at the different intensity. These are at the different level of molecular analysis. So this is all about the molecular or the spectral correlation in our FTIR. So you can see in a single bond, this O and H stretching, nitrogen and hydrogen stretching, carbon and hydrogen stretching. These all are the single bond stretching. So what is the importance of this type of spectral in our homeopathy? So generally our mother tinctures are generally alcoholic base. Our dilutions are generally alcoholic base. So you can see this O and H bond, the nitrogen and hydrogen bond, this type of stretching is commonly seen. Okay, so this will give you an idea about the characteristic property of that particular molecule, and the characteristic property of that particular molecule will show the pharmacological effect on that particular organ, on that particular cell, on that particular tissue, because as per the periodic table there are different physical and chemical property of a different elements, different compounds, different atomic structure. So whenever you prepare any type of medicine from any different sources like mineral, organic, inorganic, plants, animals, imponderabilia, and some other newly added sources. So the efficacy and the pharmacological activity and the sphere of action of that particular medicine depends on the physical and chemical property, the bond stretching, the type of bond of that particular atom, that particular molecule, that particular compound which is present in our solvent system. So here you can see, suppose if I give you the example of natramure. So natramure is a medicine which is prepared by a mineral NaCl. So the sodium and the chloride, generally these are the cation and the anion. When this molecule make the conjugation, so they have a property of retention. So when we dynamize this particular compound at the higher energy level, so their chemical property, the physical property remain as it is, but they are booster and they are just going at the higher energy shell and work like a curative action, not a palliation, not a suppression. So that's why, as per the organon of medicine, as per our homeopathic principles, we can't repeat and give the higher dosage. Why? Because when we use this higher doses or the higher intensity of this particular compounds, so there may be the adverse effect, there may be the unwanted reaction, there may be the unknown origin, the side effect, the hypersensitivity and idiosyncrasy of this different mixture or the molecular compounds in the living entity. See, this is very, very important to understand, to reflect why this type of interpretation, why the chemistry, why the physics, why the molecular biology important in our homeopathy. Even though in the syllabus of BHMS, in MD also, in PhD also, we are still not going to talk like this. Why? It is not said by Dr. Henneman. Dr. Henneman not was, he is a renowned physician. He is a great pharmacologist. He is the first experimental pharmacologist on the human beings. So generally, he knows the nature and the property of this compound. But when we talk about our education system, sorry to say, we still talk about only the symptomatology, the sign and symptoms, the drug picture of that particular medicine, of that particular remedy. But what about this biomolecule? Because when we are not knowing about their property, so ultimately we are just going to give a blind treatment to our patients. It is not true. Whenever you prescribe any type of medicine, you have to know about their biomolecular system. What are the different compounds? Either they are more in aliphatic compounds, either they are more in nitrile groups, either they are more in hydrogen-nitrogen bond, either they are more in carbon bond. So they are going to differ. Suppose when we talk about the types of constitution, temperament, diathesis, so generally we say about the carbonitrogenate constitution, hydrogenate constitution, okay, oxygenate constitution. So where it comes? It comes from these atoms and the molecular system in our cellular event. Even though in any living entity, either they are animal, unicellular, multicellular, or some other living organism, the molecules which are embedded or present in their particular cellular and the tissue structures, they are going to determine their constitution. So that's why it is very humble. It is very important analytical procedure, and it is very important interpretation for our pathy, for not only for our pathy, for this whole system. So when we talk about this, so it is going to analyze in a better way. It is going to analyze in a deeper sense. So this is all about the bond determination. Next, you can see it is another bond determination, the interpretation of spectral correlation before treatment. This is before treatment. This is after treatment. So before treatment, you can see just the intensity. So this is the intensity 1622, 1333, 1035, 722. Same after the treatment, when you prescribe any type of medicine to that particular living entity, now you can see the difference in that particular level. The intensity is now going to raise 1623, 1333, 1035, 723. So it is more than the previous one, means before treatment. So it shows after treatment, somewhere our medicine is going to act on that particular biomolecular or ionic system in the living entity. It is not only the placebo effect, it is not the magical effect. Please try to understand. Generally, in many newspapers, in many articles, previous literature, it was taught that homeopathy is dynamic, it is magical effect. No, my dear, it is only based on this molecular system which is present at ultra high dilution, at the different intensity, at the different level of wavelength, where it shows their chemical, their physical, and their pharmacological property on that particular cell, on that particular tissue, on that particular system in the living entity. So please try to understand this. Why it is important before treatment, after treatment. Now this you can compare it. Either it is going to the right direction, either it is going to a wrong direction. So it is very the most important part to analyze this type of treatment. Suppose if you talk about the treatment part, so suppose if you prescribing any medicine to any patient for any disease condition at any time interval at any particular doses for the long interval, either the acute, subacute and the chronic diseases. So for that condition, you can take the blood sample and the serum sample and any type of sample from that particular living entity, and you can go for that type of analysis under the FTIR. So here you can compare before treatment, after treatment, and the control group by the RS and the placebo group. So what it determine? It determine when you prescribe that particular homeopathic medicine to that particular group of individual personality. So what are the changes in their biomolecular system before treatment, after treatment, in the control group, in the medicine group, in this disease part, in this cellular structure, in this molecular event. So these are at the different intensity, different level of energy, different level of understanding. So this will give you the conclusivity. This will give you the interpretation at this different level of system. This is very important to know about this system. Why? Suppose if we talk about the idiosyncrasy. Generally, in drug proving, the prover should be idiosyncratic. They are easily prove each and every symptoms, signs of remedy in a very low concentration, not frequent repetition. So generally, what happens in the biomolecular system of that particular individual, that particular living entity is working at the higher intensity, at the higher level of energy. Whenever you are going to prescribe the medicine to that particular living entity, so their biomolecules are going to absorb their emission and their intensity of light, their memory, their medicinal property at the higher level. So they easily reflect the sign and symptom on the physical ground, on mentals also. So this is a way of understanding. This is a way of interpretation of the biomolecular system in the FTIR. Generally, after completing this PPT, most of the people may thought that today this session is not related to our clinical practice. We are the clinician, we are the physician, we generally know about the symptoms, we generally know about the disease part. Why we learn about this? No, my dear, we should know about this type of standardization, because suppose if you prepare and launch your patent, your formulary patent, your design patent, your own medicine, your external application. So you can know this type of biomolecular analysis, this type of molecular structure, this type of conjugation in between the two different compounds, in between the two different atoms, in between the two different molecules. If we know about this type of conjugation, so we can easily go to analyze, we can easily go to understand this type of method, this type of treatment, before treatment, after treatment, before analysis, after analysis, before control group, after control group. So this is very, very important part to know. See, this picture is very simple. It is very, very simple. Before treatment, you can see one line, a red line with some intensity. After treatment, a black line. This is just a color difference, nothing more. But you can focus on that particular intensity at that particular wavelength to determine these functional groups. So how it varies before treatment and after treatment. So this is your scientific evidence that our medicine is going to act on that particular biomolecules at the different intensity, at the different level of rotation also, that we can show the optical density, the optical rotation, either it is clockwise, anti-clockwise. Have you heard about this type of rotation? Yes, in 11th 12th in your chemistry we talk about the optical density, we talk about the isomerism, polymerization. So these all phenomena included in our ultra high dilution also. It is also included in our medicine also. So as a homeopath, we have to know about this type of interpretation in our pharmacy. That's why in every level of presentation, I explain and I always have this type of analytical and this type of interpretation with the different medicine, with the process of standardization or some other procedure in our this type of syllabus and in our pathy also, so that people should know why the pharmacy subject should be extended up to 4 years, why it should be a separate branch. Because I think pharmacy is not only the first year subject, it is not just like a mandal and few pharmacopoeia, a few volumes or a few chapters. No, my dear, it is a separate branch. When we study this pharmacy at the higher level at a separate branch up to the 4 year, so we can know more better about our drug, our medicine, our remedy also, how they are going to act at a different cellular tissue level, how they are going to mix in a different compounds, how they are going to show their synergism, their synergistic effect. So this is very, very important. We have to understand this also. So this is all about the FTIR analysis, FTIR spectral photometer. So these are the references through which we shown and we just explore this knowledge to all of you. So this is my whole part of FTIR analysis.
Yes, it's really a very, very fine presentation. Nobody could believe that these things can be done in this way. And you really show the beauty of such a research work and how one can do all these things and why one do all these things. All these things were explained in a beautiful way. So congratulations for your excellent effort. Not only you just presented, but you involved with your heart in this presentation. So that's the beauty of your presentation. You are always feels enjoying yourself rather than simply presenting and doing a duty. That's the beauty of your presentation. Anyway, we can have some more presentations from you in the coming editions of our webinar session. And now I invite Dr. Amir Malik to say from Pakistan to say a few words on the presentation as well as your suggestions to Dr. Suraj Singh.
Hello, good evening, namaskaram to all our honorable doctors, and special thanks to Honorable Dr. Suraj. Today is our guest. Honorable Doctor, you have gave a very good presentation, the scientific explanation of the homeopathic medicines. In my college life, I have used the spectrophotometer, flame photometer, gas spectrophotometer, gas chromatography, and mass spectrophotometer. And I've used first medicine which I put to take because our teacher is PhD organic chemistry. He was shocked when he listened that arsenic is our medicine, uranium is our medicine, phosphorus is our medicine. So they have a very, you can say the situation is like that. They sometimes they smile, sometimes they feel that it's a joke with us that homeopathic have all these incredible medicines which work in this way. So that time I have used to check natriumur and kaliumur on flame photometer. That time FTIR is a very big thing, very good thing because it's a scanning fingerprint of the molecule, the unknown molecule, either it is organic, inorganic, or whatever it is. But that fingerprint analysis of the molecule is very important for the industries, for the all another departments, as well as in homeopathy. Main thing in homeopathy, because honorable doctor, our father of homeopath, Dr. Frederick Samuel Hahnemann, he is already just have a V and a light on his history. He was already father of Asclepius and father of Hippocrates. The Western medicine follow the pathway of the our father. He already introduced the stereochemistry of the bonds, the levo and dextro rotation of the bonds, the isomers of the bonds, the polymerization of the bonds. Why? He just gave us to a guideline when the vitamin A was absorbed, it have to be passed over 148 steps, that is known as as isomerization. 148 isomers, and what is the end extract? Alpha carotene into beta carotene. This is the synthesis digestion of the elements in our liver and our body. But to understand this situation, that how the homeopathic medicines work dynamically, the reason is that the transfer of the molecular energy into human body. When we titrate the medicine, as same the vaccines are titrated, it have the energy and capability to cross over which thing, to treat our DNA, mRNA, RNA, sRNA, and this is the message which the chemistry of water molecule. Here it is very important in FTIR. We get to understand the hydrogen and oxygen molecules behavior with the water. What do the water with those alcohol and the ingredient we have titrated to promote and inject the system? What is that? The healing process. To understand this, is known as homeopathy. The Western makes a joke for us. I don't know why. If you think homeopathic have no medical evidence, why I just ask one question to all of you, all of especially who the World Health Organization. Just please let us know one thing: why you are forcing for the vaccines. Vaccine. The definition of vaccine is to kill the virus or bacteria in the predominant state. And the way you have to kill that is that you have to titrate that ingredient. So when you titrate the uranium, when you titrate the nux vomica, when you titrate the lycopodium, when you titrate the black mamba venom, why don't you believe the venom is no more there? So what do you think where it goes? The titration. Please give the importance to this. So I believe only this, sir. Honorable Dr. Suraj, you have given the excellent explanation. This scientific explanation is our winning. In the homeopathic medicines are not fake, not pseudoscience. They have the capability to heal the system. That's why homeopathic always claim big that we can treat better than the Western medicine, because the Western medicine is just dependent on the size of the medicine, which is created by synthetically. And homeopathic remedies, they are just titrated. And titration is our secret. And alcohol, why alcohol? There is very important graph next is test is that alcohol only have this ability to give the highest intensity. You just simply, I have to give a very simple in word one sentence explanation. We have an aeroplane, we have a NASA space shuttle, we have all things, but the weight of these machines are in trillions tons, but they can't fly without fuel. Why fuel? Fuel is a volatile in nature, weightless, and it carries a trillions of weight. What it shows, all the in all world, whole machines will be dead if that volatile energy is not available. Homeopathic is a volatile energy. Why they are not understanding? Nowadays we have a nanotechnology and they are not understanding our medicines, because it's, I believe it's only mafias which are screwing the homeopathy. This is not naturally that homeopathic have no place, homeopathic is not valid medicine. It is 100% valid. No pseudoscience, it's only a mafia which are screwing us. So only the request, Honorable Dr. Suraj, you have selected a very excellent topic. Few doctors are working on it. Our father had already worked on this, Dr. Frederick Samuel Hahnemann. But unfortunately, the biomolecular medicines, there is a big department for homeopathic. They should go to and touch the oncology departments that we have the biomolecular medicines. Our father had been done this work, but it is not sporting by our societies, by our homeopaths, by our all in the world, because who is always want to show this to world that there is no cure for cancer, except, okay, if they said they have the cure, show us the results. Out of 100, 70% cases are failed in chemo, and
Yes,
they
sir.
don't show this reality to world. So I just request, we have the life-saving drugs, we have the SOS drugs, so give us the right place, give us the right way to work the homeopaths rights. They should give us this worldwide, and I hope we serve humanity very well, very in better way, to give them a great support to humanity. So it's
Thank
a
you.
very good thing, Honorable Dr. Suraj. Love you a lot for this, and lot of love to all our honorable doctors and IFPH. God bless you, always standing with this for the life of homeopaths. So it's really good chapter you have selected. We have to go through this regularly. So because we should be strong on scientific base. We are not a pseudo false doctor and science. We are very strong by blessing of God and blessing of our father, Dr. Frederick Samuel Hahnemann. God bless his soul.
Okay,
Lot
thank
of
you, Dr. Amir Malik. And it is now over to Dr. Bob Lim.
thank you, sir. Thank you. God bless you. God bless you.
Thank you, Dr. Ganesh. I agree with Dr. Navid from Pakistan that this is a good subject, that it had to prove that our homeopathic medicine is not only a dilution of water only or alcohol. And I have a question here. You have done a very good job here in going into this field, because FTIR instrument is not very cheap. It's a very expensive instrument, and only a few labs can afford to have this type of FTIR spectrometer. So regarding that, in my country, we only have a few labs that have this type of machines, because it's very expensive. And this is meant, you say that it's meant to analyze what they call that, a compound or a substance, to find out what is inside, whether it contains oxide or carbon or aurum or metallicum. We will be able to know. So my question is, have you done a list of homeopathic medicines or remedy from the mother tincture to 6 to 30 to 200 and to 1 m to record down the there is a spectrum, there's the image, so you save the image as a fingerprint of the various remedy according to the potency. So like what Dr. Navid says, you must have a fingerprint or a library for this, so that we can present it as a scientific paper for the global community. So Dr. Suraj Singh, over to you.
Sir, basically, yes, you are correct. This type of FTIR should be done in all level of this preparation part. Previously, we had done this type of FTIR analysis in mother tinctures. In sulfur 1x, sulfur 2x, sulfur 3x also, sir, we determined the sulfur particle at the different intensity and different wavelength. Because when we go forward and when we potentize this, so the level of intensity of that particular biomolecule or the particle is going to differ. So suppose in previous year we had just prepared the liniment, ointment, lotion, hair oil. So these all were analyzed by the FTIR. So they are generally prepared by the admixture of this mother tincture from the different compounds. So they show FTIR analysis at the different level of intensity and the different level of the wavelength. But when we use same method for the higher potency, we just go up to the 1x, 2x, 3x in the powder trituration. So here we can also determine and identify that particular particle also at the higher intensity or the higher wavelength. But when we talk about 30 potency, 200 potency, LM potency, so these are ultra high dilutions. So FTIR analysis, because in this type of ultra high dilution, the alcoholic base is more, the medicinal part and the ratio of the drug is less. So generally we have more number of conjugation in the alcohol base, OH bond, hydrogen bond, carbon bond. So this hydroxyl group is commonly seen in this higher potencies in 1M, in 200, in 30 or above 1M. So this is very common functional groups which are determined in this higher or the ultra high dilutions, whereas in the mother tincture and in the lower attenuation or the lower trituration, you can have this functional group also, but some other allophatic and the aromatic and non-aromatic, organic, inorganic compounds at the higher intensity at the more concentration, because if the concentration is more, so the peak value which I shown you, the high peak and the valley, so this may differ. So this is the basic idea.
Okay, sir. Thank you very much for such a beautiful answer. And now it is up to Dr. Ram Parisa to say the vote of thanks to the session also.
Congratulations, Dr. Aneji, and very, very thanks, Dr. Suraj Singh Bhadoriya ji. Suraj Singh Bhadoriya ji is a dynamic person. Our homeopathic medicine is a dynamic. Very nice, excellent session. Pharmacology, FTIR analysis. Very, very thanks. IFPH. Very, very thanks. Suraj Singh Bhadoriya again. Childhood. Very nice, excellent session. Thank you.
Yeah, thank you, Parisa, sir. And tomorrow we will have a session from Dr. Vaidehi Bhatt, and she will be presenting another research paper tomorrow. And with that, we come to the end of the day, 1339. It is. Thank you all for joining. Thank you, Dr. Suraj Singh Bhadoriya, for a scientific session. And thank you all for joining this session. We can meet again tomorrow at the same time. Oh, thank you. Good night. And it is over to Dr. Mariama John to moderate the Malayalam session.